Hello, let's talk about supraventricular tachycardia, or what is called SVT. Normally, the electricity in the heart goes from the top right chamber to the junction down to the bottom chambers or the ventricles. In SVT, the atria or the top chambers are beating fast. Tachycardia means they're beating fast over 100 beats per minute, but they're out of sequence. There are 3 types of SVTs. In the first type, there is a tiny area in the top chamber of the heart that is misfiring, and it's going so fast that it silences our normal pacemaker and takes control of the heart through the control of the AV junction or the node. This type is called atrial tachycardia or AT. In the second kind, there is a circuit that involves the atrial and the ventricle, and it keeps looping around. This is called WPW or AVRT. The third type is a common circuit that is present in the AV node or the junction of the heart, and the electricity gets hung up there, causing misfiring. This is called AVNRT. In most cases, SVT is not a dangerous condition. It is bothersome. It can be tough if you're thinking about getting pregnant, but it's only really dangerous if you're stuck in it for weeks to months, because then the heart can get weak from racing all the time. The most common and effective treatment is an ablation or targeted destruction of this tissue. However, if you don't want an ablation or if it's unsuccessful, medications can be tried. In terms of ablation, I go up from the groin, I enter the heart after passing through the abdomen, and if it's an atrial tachycardia, I go ahead and destroy that area. If it is the second or the third kind of tachycardia, which is a larger circuit, all I have to do is cut or disconnect one part of the circuit that prevents the electricity from misfiring, because it breaks that cycle. At the end of the procedure, everything comes out. This procedure generally takes about 2 to 4 hours, and some patients can go home the same day. In terms of restrictions, the only restriction is really to protect the groins, so we advise patients not to lift anything heavy for about 2 weeks to allow the groins to heal. Depending on how extensive the ablation is, I may prescribe blood thinners to allow the heart to heal well. Before any medications or ablations, I rule out reversible causes like thyroid issues that can be fixed and reverse the tachycardia. Thank you. This is Dr. Mehta.